Hello, everyone. Welcome to another webinar in our series, Bear in Mind, Mental Wellbeing in the Workplace. Debbie, if you could share the welcoming and intro slides. We would like to thank our sponsors, Kennebunk Savings, Prime Buckles, and our content sponsors, the Richards Group and Full Spectrum Wellness, for making this program possible. Today we have quite the expertise. We have two people who have worked on this issue, and they're going to share the learnings. We have Dr. Mathew Duncan, an assistant professor of psychiatry and medical education at Dartmouth Giselle School of Medicine. Dr. Duncan is the clinical director for integrated behavioral health and primary care at Dartmouth Health, clinical director for medical student counseling at Giselle, and clerkship director for medical education in the Department of Psychiatry, and currently serves as special advisor for mental health to the provost and president of Dartmouth College. There is an extensive bio for both of our presenters, so we will share that in chat via link. Our next speaker is Debra LeClair, psychologist, executive coach. Dr. Debra LeClair utilizes a multidimensional approach in working with clients to move through obstacles and meeting career and personal aspirations. She also consults and trains in corporations, nonprofit agencies, and public schools to implement positive cultural change, improve interpersonal communication, and enhance talent retention and management. And I would like to start by handing it over to Deb LeClair.
Absolutely. Thank you, Zena. It's good to be here. Let me get my slides up. We can get going. So I just want to give you a little overview of what I'm going to start and talk about today. So we're going to talk about, like, why would you seek treatment? And I'm going to really cover the whole spectrum of that, because it's a lot more than maybe you might think. We're going to talk about resources for finding a mental health professional and the different types of mental health professionals, as well as what you can expect once you start, once you reach out to a therapist, once you start working with a therapist. And I'm hoping I can give you the perspective from both sides, because I've certainly have utilized my own mental health services over the years. So hopefully all of that will be baked into this as we go through. All right. So why would you seek treatment? You know, when I started graduate school, they would tell us when people are in big enough pain, they're going to reach out. And I think that's changed a bit. I think we know that there's so much more that we can do around mental health services. But, you know, obviously it is to help you suffer less. It's help you to heal what might have been hurt. As a human being, we're all going to have hurts. We're all going to have things that happen to us that we need to talk through. So this is a great place to go for that. A big piece too is also breaking patterns. There might be some patterns that might have served you in a prior time of your life that aren't serving you now. And it's great to be able to explore that a little bit and to know that you don't have to figure this out alone. And there certainly are different and new perspectives that you can gain on any kind of issue that you are working with. So some specific reasons to seek out treatment are if you're experiencing, maybe you're in a deep funk, your energy is really low, it's staying that way, you're not really sure why, maybe you're feeling a lot of sadness, maybe you're not finding pleasure in things that you used to. Maybe you are having trouble sleeping, and a lot of that has to do with intrusive thoughts, thoughts that just keep coming into your mind. Maybe they're racing thoughts. They're really making your heart beat fast. It's making it very difficult to sleep. And of course, when you don't sleep, that sets off a bunch of other patterns that happen. And maybe while in your wakeful hours, you're finding that you're also having some negative thoughts, a lot of intrusive thoughts. Maybe they're about yourself, maybe they're about other people, maybe they're about the situation. But again, it's making you, it's really impacting how you're functioning and how you're feeling, and it's certainly impacting your well-being. Other times to seek out treatment is perhaps you're feeling triggered. Maybe something that didn't bother you is starting to really bother you, whether it's some anxiety that you're having, or again, some of these other types of things that I've just been naming. Maybe you're finding that you are getting a little bit more over-reliant on some compulsive behavior, whether that's sex, shopping, gambling, and obviously substances as well. And I would say the number one reason, without a doubt, always, 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 if you are having any kind of suicidal thoughts, any kind of homicidal thoughts, though that is a key reason to get some help. So you can kind of see that this really does run the whole gamut. Okay. So other reasons to seek treatment, and these are ones that sometimes people don't always realize are available, is if you're dealing with grief, especially if it's fresh grief. Bereavement counseling is a common and often utilized service that is available. That's usually in the more short-term space. There's also the grief that lingers. So there's things where you're just, wow, I just can't get over this, whatever it might be. A job loss, a loss of a human being, a loss of a pet. Sometimes that's just really stuck for you, and you're really finding that you just can't get to a place where you can function in the way you had at one point. Life transitions are a big and great reason to seek out therapy. So sometimes we have really wonderful things coming up, a marriage, we're getting our dream job, but it doesn't mean that there isn't a lot of feelings and adjustments that have to happen around that. Again, seeking out psychotherapy or counseling is a great space to be exploring this and to do it as best you can. Difficult situations obviously are also good reasons. We all have these. That's the thing. I think sometimes there's shame, and some of the stigma of seeking out treatment is we think we're not supposed to have this. We're supposed to actually get through life without ever having stress, struggles with work, issues with family. It happens. It absolutely happens. And I think it happens probably to 99.9% of us. The other part is probably the Dalai Lama. So it's just, these are inevitable things, and it's based on how you feel about it. And again, having somebody to talk to, especially somebody who's professional, knows how to get you into a better space, help you get to your own better space is a really great way to go. Now, one of the things that we know, it's been identified by the Surgeon General, is we have an epidemic of loneliness that's happening right now. And what's underneath that is that feeling that you don't belong. It's another great reason to seek out treatment for practical reasons of finding ways that you can belong, but also exploring what does that mean for you at this point in your life. Another thing that I see a lot of, I see it in coaching, and I definitely know that it's very present in counseling and psychotherapy situations, is people are talking a lot about a loss of meaningfulness. So things that, again, you really felt like you knew what your purpose was in life. You really knew what really mattered to you. You start to sometimes lose that at certain points. And a lot of that is connected to feeling disconnected from your soul or your spirit. Sometimes people will describe wanting to come into treatment because they've had a soul crushing situation happen. You know, when you start to hear that kind of language, that is definitely saying this is a good place to bring these issues in, to bring it into therapy. Another one that I think is gaining more awareness for people in general, I would say in the workspace as well as otherwise, is self-sabotaging patterns. Again, we all have them. It's part of how we function. So there might have been a pattern that really worked for you, a pattern of behavior, a pattern of attitude that worked for you in the past that isn't working so well for you anymore. Or it's overworking, and that's something you might want to explore. That's something that we see a lot of people really looking to understand themselves much better. Okay. So let me give you some resources that you can use around these kinds of things. So if you're looking for a therapist, you're looking for somebody in the mental health space, the employee assistance programs, chances are especially if you're in a large workplace, you probably have one. These tend to be underutilized, but they're excellent in terms of the variety of things that they tend to have. And I know that some people have found really, really great help just going that route initially. You can also connect with your PCP or other health professionals that you see. You know, you'd be surprised. Your massage therapist might have a great recommendation for somebody for therapy. So that's usually somebody you already trust, somebody who has some sense of you, who already knows you. And in some cases, it's really nice that they have that knowledge of you, because then they start to become part of your team going forward when you are moving towards getting a therapist per se, or a psychiatrist if you're looking for some medication. Insurance company, obviously your insurance company is going to have a list of practitioners that fall under your coverage. So that's a good place to go. I have to tell you my absolute favorite, because it is such a great directory, is the Psychology Today Therapist Directory. And we're going to put the link to that in the chat so that you can access that. What I love about this is you usually get a picture of the therapist. There's something about looking into somebody's eyes when you're going to get into that kind of a relationship with them. It's really kind of helpful. It'll tell you their specialty areas. It'll certainly tell you their credentials. It'll tell you where they are. It'll tell you if they're online or in person or a combination of both. It'll tell you if they're accepting new patients or new clients right now. And usually a way of, obviously, a way of connecting with them. Super, super helpful. I think it really gets to, it saves a lot of time, I think, because it used to be you were flying blind a little bit. You just have literally just a name on a piece of paper or online, but now you've got a lot more information. Now, if you're looking for like some more broad, general, but also very specific about acute issues around mental health, and issues that also include things around children and family, it's really helpful to look at the NAMI New Hampshire website. If anybody here was in the Refilling the Well this fall, we did an interview with the director of the Youth and Children's Services. I hope that's still online. You could probably still access that on the NHBSR YouTube channel. And but anyway, no matter what, this website is packed full of resources for you. It's quite excellent. Now, if you are in an acute situation, if you are in a crisis situation, New Hampshire has the New Hampshire Rapid Response. So here's the information for that. You can call or text. You can start a chat. And we also have now the suicide prevention line. So just like the 911 number, we now have 988, which is something, again, great place to start with really well-trained people that will help you, give you resources, help you work with whatever is going on for you around that, and get you into a better situation, and usually connect you to the other mental health professionals that you will need going forward for that. Okay. All right. So I want to just give a little sense, because there's a lot of different kinds of mental health professionals that are out there, and it can get a little bit like an alphabet soup for sure. And I really went back and forth on how overwhelming did I want this slide to be, but I did want to give you a sense of what the letters behind somebody's name looks like. And I tried to include letters that you might see in other states, not just New Hampshire, but our surrounding states as well, especially as we are as this is a changing place in terms of online therapy and things like that. So we start off with the medical and the diagnostics. So these are your MDs for the most part. These are folks, psychiatrists. Dr. Duncan is a psychiatrist, so he can certainly speak to this. But these folks are often trained in talk therapy as well, but because there is such a need for medication as well as medical diagnostics, because sometimes what we have is we've got an underlying condition that is maybe exacerbating something that's making you feel depressed or making you feel anxious, and that's an area that they're looking at, so they can kind of look at the whole picture that way. But with that, they also are, like I said, prescribing medications and also monitoring those medications. They, along with psychiatric nurses. At the level of having a doctorate, you have us psychologists. So we have several different kinds of initials that we have behind our names as well. They really are equal. They're just coming from a slightly different place. So we specialize in psychological assessment. We also do diagnostics, but we stay more in the psychological realm, the mental health specific realm. And we are also trained in psychotherapy. Usually when you've got something that's maybe quite an issue, you definitely, it's a nice idea to think about seeing a psychologist where you really might need that assessment. What I should say here as I'm going through this is just know that every person that you would be contacting on any of these types, you don't have to be an expert on what you need. They will know. So if they feel that they're not the right fit for you, they will move you towards the right fit. They'll suggest another kind of professional for you. That's actually our ethical responsibility to do that. So I just want you to know that, again, I don't want this to be overwhelming. I just want to give you a sense of what exists out there. I would say the most common therapist is that I've seen typically is somebody who's been trained in social work. So they're coming from a social work background. Some of them also do some mental health assessments and definitely do the psychotherapy and counseling as well. Sometimes you have specifics, specific professionals, those that work with marriage and family issues. So bringing in kids, issues around children as well. You'll see that with those professionals. You have master level, just psychotherapists and counselors. So counseling, people often ask what the difference is. Counseling is usually when it's a shorter term issue, like grief is a good example. Psychotherapists is when it's usually it's a little bit deeper, little bit, something probably more long-term. Again, you don't necessarily have to know what your issue is. When you contact somebody, they will have a sense of that and be able to direct you into the right place. Now, if you're somebody of faith, or you're somebody who really would like some of your spirituality considered and integrated into your treatment. Now, I will say, a lot of us have been trained in those different areas, but a nice place to go is a pastoral counselor. Manchester has a pastoral counseling center specifically. So this definitely exists in the state. It is something you could certainly access. And you will often see that they do have some kind of theology or ministerial kind of degree that goes with that as well. And then the other layer tends to be more of an undergrad degree, but it is intensive in terms of its training, which is alcohol and drug counselors. Now, often what you'll see as you look through this, you'll see the letter L. That means licensed. So any of us that are in mental health have gone through pretty major training, I can tell you that. And then we have the Board of Mental Health Examiners that's on the state level, and they have a whole other level. They require the education that we have, but they usually require clinical hours that are put in post-degree or maybe towards the end of your degree, and then moving you towards being able to become licensed. It is a pretty, New Hampshire is definitely, they really make sure that you're qualified. I'll put it to you that way as you go through it. So, let me talk to you a little bit about what happens in therapy. I think sometimes this is the thing that I think could be the most helpful thing to know. So I have diversity considerations. So something to know is we have been trained. We always get diversity training. I don't know if I can say that that's 100,000%, but I'm pretty sure it's about 99%. We have it in our continuing ed. We have it, especially now, we have it, we usually have it in our graduate and in our other kind of professional training that's very present for us of how to work with people from different backgrounds, different sexual orientations, those kinds of things. However, I will tell you, for you as the client or the patient, this is one time you don't have to worry about being politically correct. It's not about that. If you'd rather work with a woman or you'd rather work with a man, we encourage that. That absolutely is huge. In fact, that's usually the first question. If I have a coaching client who needs therapy, I will always ask them, what do you prefer, a man or a woman? There's some times where you prefer somebody is of the same sexual orientation as you, or can certainly understand that, or is of the same ethnicity or the same race as you, because there's something about that. Again, this is an intimate relationship. This is a relationship where you want to be able to let your hair down and be real. So the more comfortable you can feel, the better. So if you are a person of color and you want to work with another person of color, that is, go for it. Absolutely. That is, we encourage that. We absolutely encourage that. So at the beginning of the relationship, so as you reach out to people, potential mental health professionals that you want to work with, what will usually happen is you will have an intake assessment. So sometimes that starts over the phone with them, or I think in some cases you might be sent something electronically. Other times it does happen, or it continues at least in the office. So all the usual questions that you usually fill out around medical history will probably be there, but then there'll be some things that go a little bit deeper. It'll ask you about alcohol and substance abuse. It'll ask you about potential trauma issues, things like that. What we want to do is we're trying to collect as much information as we can so we understand what is going on for you, and we can do the best for you, whether it's direct you towards additional services or other services in the mental health realm. Other things that come up is we always want to explain about confidentiality. As a profession, we actually didn't need HIPAA. We've always been incredibly huge on confidentiality. and understanding, that a lot of information is very, very private and needs to be protected. Now, there are some limits to that. So if you said to us you were suicidal, you had a plan, you were thinking about it, or you were homicidal, if you're going to hurt yourself for somebody else, we are required by law to inform the police. But we tell you that, and we tell you that up front. We always want you to know those kinds of things. So we do talk about that in that informed consent. What are the parameters of that confidentiality? And how we would always be coming to you almost in any other situation to give us permission. So say you start with us as a therapist, and then you're going to reach out and you're going to start working with a psychiatrist for some medication. Maybe you would like us to talk, or maybe we're thinking it's a good idea that we talk to each other again as part of your team, and that you give us permission to do so. So that's where that comes up. We also just talk about the basic logistics that come up around this. So it may be insurance company, how are you going to pay, best times for us to schedule our sessions, things like that. Now in the first session, even though you might have had some back and forth, and you might have felt like you answered this question already with your therapist or with your psychiatrist, almost always you're going to be asked, what brings you in today? Because we always want to know what's going on for you in this moment, as you've just walked through our door and have sat down on our couch or on our chair. So we always want to know where you're at in that moment. And sometimes I can feel a little like, oh, okay. Another question I'd like to ask is, how is it to be here? And this is a great opportunity to just let that honesty roll. Yeah, I'm kind of nervous. Kind of stressed about being here, or I'm really excited. Or I'm both. I got both going on. Or somebody's mad at me that I'm coming here. I mean, there's all these things that can come up that we just want to get on the right foot, help you feel that you can be that honest. So just know that that's what we're going for when we ask a question like that. In general, we will ask a lot of questions, especially in the beginning. We're doing a lot of exploring, and we're doing a lot of deep listening on multiple levels. And this is meant to be non-judgmental. Now, we're hearing things maybe that are diagnostic and important for us to know, because again, that will help us determine best treatment for you, or best questions to ask. I think it really kind of boils down to that, to keep you kind of connecting back into yourself and understanding yourself, because ultimately that's what we're going for. But the idea here is that please know that these are meant to be without judgment. They're meant to be. You're supposed to feel that there is this unconditional acceptance in this therapy room, or speaking to anybody in the mental health realm. Now, in terms of the following sessions, you basically will be setting the agenda. It's what you bring into the session that you want to talk about. Now, we will follow up with you on things, and that will certainly be true around medication monitoring and things like that. We definitely want to know what's going on. Are you taking your meds on a regular basis if you are on medication? Or there was an issue and you said, I'm going to do this step, and I'm going to do a little homework, and I'm going to do this. We're going to ask you about that for sure, because we want to keep you accountable. But again, it's meant to be done in a very non-judgmental, supportive way. The other thing that we listen for, and we also welcome you coming in and asking about, is, are there other supports that you might need or want? So again, medication, like I'd mentioned, maybe there's a specific kind of therapy that would be really helpful to you. Maybe you're really struggling spiritually on something. So maybe it makes sense that you also have a spiritual director. Maybe there's some recommendations around something connected to the physical body. So we're going to be looking at that. Occasionally nutrition comes into these things. Art therapy, music therapy, yoga therapy, all these other great modalities that are available that can really help, because the bottom line is you are a whole person, mind, body, spirit. And that's what needs to be considered as we go through these processes. Okay. All right. Sorry, just having a little trouble getting to the right thing here. All right. So my last slide, I just want to talk about what our goals as professionals are for you, so that you also know what you're getting into. We always want you to feel safe from the second we talk on the phone to the minute you come into their office for the first time, and every time you come into our office or meet online. We want you to feel welcome, and we want you to feel understood. So, we ask clarifying questions sometimes. We want you to understand yourself. I mean, that's, again, it's coming back to that. So while an issue might be challenging for you, and it might be difficult to talk about, it's vital we work through it, and we're here to help work through it together. So we really want to uncover how you really feel about something, and also to be able to see patterns, because that's when changes can happen. that's when the suffering can start to be lessened. And what we would love to see happen always is that you start to feel a sense of relief. This is a support for you. This is a place for you to go and talk these things through. And with that you also feel empowered. So oftentimes as somebody's in therapy, they're talking about maybe they've got a new perspective on something. And we're talking about maybe there's some new skills we talked about, and we're going to try some new behaviors out. And there's nothing better than a client who's excited to come in and talk about how that went, whether it went really well or not so well, and you want to talk it through. You want to get it into a better space. So it is about trying out those new feelings, perspectives, and behaviors. We also are here to help move through stuckness. Because this is us in our most human state. We don't just do this and we're like fabulous at a certain point. We do this, and that's how life is as well. So there might be a point where you're doing great and then something gets in the way. You get stuck, or you feel triggered. Some old reactions, old behaviors come back after maybe they've been gone for a while. That can feel really disheartening, but it's a great thing to bring into your therapy to start talking about. The other thing that we look at too is those mind, body, and soul connections. We really want to help you be able to feel like a full person and feel connected to all those different things. You might have a lot of anxiety, but there's something you can do. You can, as you guys know, from Refilling the Well, we can do some mindfulness that can help you with those stress symptoms. Sometimes we think we have no control over things. So it's also helping you find out where you can have some what we call agency, or you feel that you can have, again, your own empowerment towards these things. So I think we will have time for questions and answers at the end. Please correct me, Zena, if I'm incorrect on that.
Yes, and I
Okay.
encourage people to put their questions in chat during, don't wait till the end. Please just type your questions in chat, and we are going to switch modes now and go to Dr. Duncan, and we're moving from the individual to the organizational level and how you can take care of your employees and the models that different organizations use. Go ahead.
Thank you, Zena. And thanks, Debra, for setting things up for the discussion today. And what I wanted to start with is some background. And I think what Debra's laid out is a range of all the reasons that people can go and seek counseling, which I fully support and agree with. And I want to double down on the Psychology Today reference as probably one of the best references that individuals can use to try to connect with care. We're going to start here with taking a little bit of a step back. And just to reinforce that, in addition to the broad list that Debra talked about, formal mental health conditions, diagnosable according to what's called the DSM, impact many, many people. It's half of us in our lifetime who will have a diagnosable mental health disorder. It's also the case that only about half of people who need care connect with that care, including about 25% of people who are trying to connect with care for these diagnosed disorders and are never able to make that connection. So the system, as you're probably well aware, can be very challenging. And part of it can be the complexity of the provider types that Debra laid out, and others can be navigating payment and where people are. But it's harder and harder for people to connect with care. Now, I think it's interesting that the states of Vermont and New Hampshire rank very high with regard to access comparatively. So Vermont is considered to have the best mental health access in the country, with New Hampshire not far behind at 7th. It is important, I think, also to recognize that what that means is 40 to 50% of people who need care still do not connect with care. And there are states where that can be as high as almost 70% of people who have a diagnosed illness and need care do not connect. So it's more the norm almost of not making their way to that counselor or that psychiatrist that Debra has laid out, which is a major challenge. And really what has happened is for about the last 40 years, the mental health care system has been fragmented. And this has been through a series of insurance company barriers and low reimbursement, or from states really restricting funding for things like our community mental health centers. And so what has happened over this period is that the primary care doctor's office has emerged as the de facto mental health care system in our country. So it's over 55% of people who seek mental health care get it from their primary care doctor. And then as you go down those formal mental health specific trained people that Debra laid out, it declines. And there's a challenge to that, which is primary care offices and clinics were not historically designed to really address mental health and substance use, nor are they traditionally staffed with the kind of professionals that are trained in this. And the second slide that you'll see there is another data point that says that many people, when they seek behavioral health care, are having to do it outside of the insurance market. So among the people that Debra laid out, all those licensed professionals, it's a significant number of them and disproportionate to other medical care that opt out of insurance. And that can make the navigation difficult, and it can also make it costly to seek mental health care. So one of the models that have emerged over the last 15 years or so to address the primary care component is a model called collaborative care. And collaborative care is an evidence-based approach that builds new team members within a primary care practice to support those patients seeking care in that primary care space. And it centers upon adding a behavioral health specialist. In our system, we have 17 primary care clinics that have this collaborative care mental health care model. In the diagram to the right, you'll see at the bottom left, there's a behavioral health care manager. That's kind of the new addition and the central piece. And in our system, those are all licensed clinical social workers or licensed clinical mental health counselors. And they are there full-time in the clinic, where they can immediately come into a visit and meet with a person seeking mental health care in that visit with the primary care doctor. We also use principles of population health and chronic disease management, kind of typical for diabetes, cardiovascular disease, et cetera, where all the patients receiving care are followed as part of a registry. And each week, that behavioral health person meets with an external psychiatrist. So this is someone who is not in the clinic, different than the primary care doctor and that behavioral health specialist, but each week goes through all the patients who are actively receiving care to give consultation and recommendation. What's different about this is in this model, you'll see those dashed lines. The psychiatrist is not meeting directly with the patient. The psychiatrist is actually giving guidance to the behavioral health care manager and to the primary care doctor to deliver that care. So it's kind of recognizing that this is where most of the care is being delivered, but helping support the practice and support the patients with an augmented level of care. And over 100 studies have been published that this model of care far exceeds the efficacy of no model, and for many people can reduce the time to care to a day or a week, where if you go out onto the market to find a counselor or psychiatrist, that can sometimes be months for you to even initiate that care. So major advances with that model. The other thing that's happening because of this fragmented system is more is coming back to employers and the workplace to develop programs and supports themselves. And I just wanted to share with you something that we are just starting at Dartmouth Health. This past year, we call it the Dartmouth Health Behavioral Health Solution. One aspect of this is a new and central website. It functions as really a single access digital front door. And it's meant to pull resources into one place, because one of the frustrations people have is trying to navigate this complexity. So this website called Cobalt provides a few advantages to business as usual. One is that employees can direct schedule with mental health providers without having to go through other avenues of kind of trying to seek referrals and go through clinical processes. They can go direct to scheduling with a team that's there for them. They also can chat or call a resource navigator. These are people who are simply there to help identify who could be counselors, even help with a Psychology Today search, and guide people until they make that contact. And then there are group offerings, which I'll describe in a moment, and then a curated self-help library. For the groups, these are kind of interesting in that they are now all virtual. This is kind of one of the benefits of the post-COVID era, as we as mental health professionals have gotten very comfortable with telehealth and virtual platforms. And so things that you would have had to set aside time and travel for, you can now do virtually much more efficiently. And these groups can be accessed anonymously. You know, even though more people are seeking help for their mental health, there still is a strong stigma around mental health care and certainly substance use care. And so these can be sought anonymously. You can log in, not turn on your video, blank out your name, and you can still participate. And then with the self-guided resource, this ends up being kind of hundreds of skills-based or informational-based articles that are curated by a group of clinicians and then are easily searched through a search database that uses kind of common language. So you can find things on topics such as recognizing your own symptoms, even how people might respond to stressful world events, how you can take care of others while taking care of yourself, balancing work life and personal life, and even courses on stress first aid for healthcare workers in our setting. So it's a relatively new program, and I think just kind of highlights what has been a movement to move mental health beyond the walls of the therapist and beyond the walls of the psychiatrist, and take a much more public health and population health view, and bring some of that actually into the workplace setting. It's been a while now where work and mental health have been talked about together. Historically, it's been about how workplaces may actually have adverse effects on mental health. Certainly the concept of burnout, which emerged in the literature prominently in the last 10 to 15 years, is something that we hear about, I'll talk about in a moment. But I think what we're starting to see, and I'll give you a little preview into the Surgeon General's most recent report, is a hope where workplaces, through some of this emerging science, some of these emerging models, can begin to turn this narrative from places that may drive burnout to places that can actually support mental health and well-being. So burnout actually emerged as an idea in the 1970s, but started to really gain traction, at least in the healthcare field, and then as I've seen it in other workplaces in the last maybe 10 to 15 years. And it's this notion that if these areas in the left there, that yellow oval, things like total workload, employee control, a sense of reward from the work, Debra talked about meaning in her slides, a sense of community, an overall sense of fairness, or the idea that a person's values aligned with the workplace values, if these are out of sync or if there are mismatches in these domains, then it's pretty reliable that things like physical and mental exhaustion will emerge, a sense of cynicism, or in the healthcare field, we talk about like an empathic or emotional hardening, or people feeling like they're working, but they're not effective at their work. And so it's pretty accepted these days that a workplace that has significant mismatches in some of these key domains place employees at risk of burnout. And this is now recognized, as by the World Health Organization as an occupational phenomenon or an occupational hazard. And that's a major change, because for about a decade, it was the idea that employees needed to make themselves kind of more resilient. And what we're seeing is a strong shift toward workplaces making themselves more mental health healthy. And yes, we should still all do those things like refilling the well and mindfulness and yoga and good self-care. Those matter. Those make a big difference. And yet, if there are significant workplace issues in these key domains, the most resilient people will experience burnout. And what we're seeing within the physicians, for example, is upwards of 60% of physicians and healthcare providers are experiencing burnout in the workplace. If you assess that group of people's resilience with validated scales, they are more resilient than the general public. And so resilience is not an antidote to burnout. It's a helpful piece, but is not sufficient to protect people. And so, as I mentioned, what's starting to emerge now is some of this historical research on burnout, some of these models for improving community, improving belonging, making workplaces more psychological and physically safe, destigmatizing mental health care, making access to mental health care and well-being resources more easily accessible while at work. This is what Dr. Murthy in his Surgeon General's report is really laying out as a vision to move these from places of risk to engines of psychological health and well-being. Quite a bit of work would need to happen there. But I think as we're seeing the mental health care system, number one, is not adequately staffed to really take care of people with the result of what's happening in our communities and in our workplaces, in our lives. But this more public health and population-based health approach is needed if we're really going to make advancements in turning the tide on mental health and well-being. So I will end my comments there and hopefully allows us some time for questions if people have them.
Yeah, we have a question right away, and it's I think it refers to the collaborative model that you explained. I'm an adult support group volunteer with NAMI New Hampshire. Should I now recommend to families to go to their primary care physician with concerns about their loved ones to get help for them?
I think, as I say, it's kind of become the default, and many primary care practices are increasingly prepared to address these kinds of concerns. Not every primary care practice has the programming or the personnel in place. So I think it partly depends a little bit on where that person is getting their primary care, of whether that place would be ready to receive them, but increasingly so. And so I think in the absence of maybe starting somewhere else, it's always a better place to start than nowhere. And more, there will be resources there specific to these needs.
And again, I encourage you to either raise your hand or type in chat. Dr. Duncan, another question I wanted to ask is, how can workplaces, organizations measure the effectiveness of their mental health initiatives so they can improve or know if they're doing it correctly?
Yeah. Yeah, this is actually a really, really good question, and it's not an easy one, right? So a lot of workplaces are using engagement surveys, and they have some markers of mental health and well-being built into most engagement surveys these days. So that's one. We can talk about what some of those measures might be. From a workplace perspective, things like absenteeism, short-term disability for mental health reasons, those might be some more kind of hard number markers that could tell whether some of these programs and supports are making a difference. We also screen our populations using some clinical tools, and I don't know that would be appropriate for all workplaces. We happen to be in a healthcare setting. But certainly doing volunteer, optional, anonymous surveys where people can self-assess, and then from that having avenues where they can connect to care. You can use some of that data to know how many people are accessing screening, how many people are showing positive for things like depression and anxiety. And then you might be able to get some markers of people who are then being referred and connected to care. Things like traffic to the EAP programs. I would echo what Debra said, is a lot of these programs are very good. They've been in place for a long time, but they do tend to be widely underutilized despite these issues. And so you can look at data related to someone's EAP. You have to be careful. There's pretty strong firewalls sometimes between an organization and the EAP, which we want to preserve. But I would say that, engagement surveys, some of the hard markers of whether people are at work or not are going on disability, or these other intermediaries like syndromes, symptoms, or help seeking can all be markers.
And Debra, I wanted to ask, what are some of the misconceptions about seeking mental health services, and how can we address them in general, and especially in the workplace?
That's a great question. That's a fabulous question, actually. So misconceptions, I think one of the things I've run into is that it means that there's something wrong with me. It means that people will use phrases, I'm mental, I'm crazy, I'm bonkers, and it's really almost none of that. It's really more, again, you're suffering and you don't have to. And there's so much great stuff to be talking about with your mental health person, that you can, that and tools that they have. We have so many more tools and so many other great therapy modalities that can help us. So I think that's a big piece of it. I think it's just, if you're suffering and you're a human being, go. Connect. And it doesn't have to be forever. You know, I think another thing is, we are subject to what the media images are. And I think we've gotten better at showing what therapy might really look like. I think that's gotten a little bit better, but initially our examples were not great. They were kind of comedy, and they seemed sometimes a little bit ridiculous. And again, you would maybe watch somebody on TV and you would say, that's not me. So you wouldn't relate, and you wouldn't necessarily see yourself wanting to go and get that kind of help. So in terms of turning that around, I think there's a couple things that have been going on. One thing I've been grateful for is to see that a lot of celebrities are coming out talking about their mental health challenges. Simone Biles comes to mind, the gymnast. There's other athletes that have come out. In other words, we're getting it across the spectrum. Other people just talking about their mental health issues and how important it is to get therapy. I also think we're getting more realistic depictions of it. And I think it's also, we are seeing it. I was trained initially as a school psychologist, and we are seeing that, sometimes, again, we have a lack of personnel that have been trained in this, but we're seeing that comes more and more into the schools. So, what we always kind of hope happen is as a child goes through, they've gotten help from their school counselor. They've been in maybe some programs, things like that. It starts to become more normalized. You go off to college, maybe you see somebody in the counseling center, and then from there, you're like, yeah, therapy is something I use from time to time, or sometimes I use it for long periods of time. It's just something else. It's like anything else, like me going, if I broke my arm, of course I'd go to the doctor. So of course I would go and get some help around this. And there's other ways of doing it too. There's groups. It doesn't have to always be individual. You can go for short term. Maybe again, it's a short term issue. Maybe it's a support group, run by somebody with mental health in their background. So there's, I think the more that we can just sort of accept that this is part of being human, and being human is hard. And it's really great to get another perspective, or to have another way of being brought through something, instead of our own, maybe ways that we've been looking at something. I think that can really start to shift how things go. I don't know if I answered the question as fully as I'd like to, but yeah, that's a whole session in itself.
I think another question, and I'm opening the questions to audience. Please raise your hand or add in Q&A or chat, whatever you feel comfortable with. You can ask questions anonymously in Q&A. One question is an experience that we've been having running the Bear in Mind program. We've been trying to, and Debra, you're aware of this, that we've been trying to do a burnout and stress management session. And now we see a lot of interest from employees in that, but the management is not interested in paying or investing in something like burnout. So this is a question for both of you: the disconnect between the need in the employees and the understanding of upper management.
I can take a first stab at that. I think, as I mentioned, really the momentum in the field around burnout has squarely put the lens on workplace as the responsible initiating parties, and leadership as really driving that. So I think if employees are expressing interest and management and leadership are not supporting it, that doesn't surprise me. That's a dynamic that's not going to, work very well. So I think unless business owners, business leaders, and managers really understand that burnout is a workplace, it may not be about the coal miner, it's about the coal mine and the conditions of the coal mine, that's just a place that's maybe not really ready for that. There was a big emphasis on individual burnout management, 5 to 10 years ago, but I think that we're well past that. So I think it might be advocacy. This is hard, right? If you're an employee in an institution, but it really does need to be where leaders and managers are taking ownership for the workplace with regard to burnout. People can make themselves stronger. People can do skill building. I really, really support all of that. But these are organizational practices.
And I would agree with all of that. And I would just add to that, what I've seen sometimes as a coach actually is working with leaders is sometimes they don't feel very prepared to deal with anybody's emotions. And because of that, they don't address it. They gloss over it, they ignore it, they say, just do your job. That people are just going to have to deal with it. So I think sometimes also giving them some direct supports is, some education. I know I know this isn't exactly the same thing, but the mental health first aid program can be helpful. I mean, just when that starts to happen again, you start to break the seal of not knowing how to deal with it. And then when you do know how to deal with it, you're also going to be able to better recognize it. And the more, for lack of a better way of putting it, the more comfortable somebody in leadership can be around these issues, the more they're going to be open to hearing their employees, recognizing it, and then being able to address burnout and everything that comes with it, the depression, the anxiety, and sometimes the trauma as well.
You both mentioned, Dr. Duncan, you're working with students at Dartmouth, and Debra, you were trained as a school psychologist. I'm interested to know your perspective on the young generation, the Gen Z that's coming into the workplace. Are they, we've been hearing statistics that they are experiencing more mental health needs. Is that because they're seeking help? Are they finding help? Or is it what they've been through with the pandemic? What are your comments on the new generation that's coming into the workplace right now?
Yeah, I can certainly start with that and be interested in Deborah's thoughts as well. But there's no doubt that by all markers, measures, surveys, data sets, that young people are experiencing significant increases in common mental health concerns. So rates of depression are the highest they've been, and the rates of increase are the highest they've been. Anxiety is very high. 60% of young people ages 18 to 24 will have a diagnosable anxiety disorder. Substance use, alcohol's going down, marijuana's going up. And suicidality, probably the most concerning, is still kind of strongly trending up and seems to be kind of moving even earlier and earlier. Like the most recent data shows that it's 10 to 13-year-olds who've had the most significant increases in suicidality. So that's an age range that's kind of earlier than what we were seeing before. We're seeing it in our emergency rooms, people come presenting for high levels of care who cannot get care. What all these drivers are, we don't really know. I mean, people have lots of theories, right? The world is more fast-paced change. Anxiety is a normal change emotion. It's a healthy thing that orients us to change, but we're just faced with never-ending pace of change. And so I think anxiety is mobilized as a healthy emotion, but because of the persistence, it becomes kind of a pervasive emotional state. There's certainly all the impacts of social media, and young people's development is not well served by comparison and kind of always being in a transparent world. People need privacy, people need stability, for kind of normal, healthy development. And the economic uncertainty and climate uncertainty and global uncertainty. So I think there's you could pick any intersection of probably a dozen factors and make a compelling reason of why things are more challenging for youth. They do seek care at higher rates. And I think that is a little bit, I would want to be careful in kind of telling the story that we're seeing more young people, higher numbers because they're seeking more care. I think they're actually just less stigmatized around help seeking. So I think the rates are higher and they're more likely to get care, which is actually a good thing because that will be, important. But it's a uniquely challenging time. And as they enter the workforce, I think they have more expectations that people will be receptive to their mental health needs, that they'll be more willing to have flexible work schedules to accommodate their needs. Because what they're seeing in their academic and their educational environments is a movement toward that. So I think that they can run into a real mismatch when they hit some workplace environments because education's been moving pretty quickly in that regard.
Yeah, I would agree with that. Also, the social media I'm seeing is just been such a strong issue. I think the electronics in general have been an issue. I mean, even the posture of looking at your phone, there's been some of the yoga research and some of the more somatic therapy research has been looking at just this posture as a depressive posture, to be looking down all the time. It's telling the body we're depressed. And that's I think also adding into this. And I'm going to say something that's a little maybe less academic, but I think we're very disconnected from nature, and we're disconnected from our true natures, if that makes sense, if that follows. And I think that also connects to a lack of, and I don't mean necessarily religion, I mean spirituality. And I think when you're missing that much of yourself, you've got a body you're angry with a lot of the times. You're doing a lot of that comparison, and you've got a nervous system that is not fully developed, but is taking on things, to Matt's point, taking on things so fast and so intense. And of course, this is a very, very intense time. All of those, you add all of those things together, and it's, and you're missing some of the resources that prior generations had. Now, in New Hampshire, we do have a lot of access to nature, but really being able to connect with it and feel like it's, that we're a part of it. And again, I don't mean that to sound corny. There is some research that's behind this, that's showing this, it's really key to see that. And we're actually starting to see some mental health programs around bringing kids back out into nature, really connecting to the trees, not just going for a walk, but really connecting to the living creatures that are there. So I think that's in this mix. And I think that's part of the, going to be part of the solution going forward.
Thank you both. I want to thank both of our presenters. Thank you for your insights, expertise. This has been a very informative webinar. I want to share a couple of upcoming, and you mentioned it in your presentations. Debbie, if you could share the final slide. A couple of our upcoming trainings that are available to all our members for free. We do have a limit of 30 registrants, but please sign up if you would like. We have a March 22nd training in QPR, which is mental CPR. Basically, it's the for suicide prevention, and it's in 90 minutes. Again, this is free and available to you all. We will put a link in chat. It's also available on our website in upcoming events. We also have our fourth offering of mental health first aid training. It's a full day training. It's perfect for managers, anyone who's a team lead or anyone who's working with teams. This is perfect to recognize the first signs of mental health issues and how to address them. You're not going to be able to diagnose, of course, but you will be able to provide resources and help to your teammates and family members and friends. So we do encourage you to attend these trainings. We offer them for free. Please sign up, and we hope to see you there. Thank you all for attending today and for being interested in this issue. Thank you.